Today I want to talk about this issue, the difference between brain health and mental health. And I attended a really good seminar over the weekend with Dr. Oscar Kurtzy, probably the world's top authority on brain health from a nutritional perspective, and how that associates and relates to mental health. So there's all this conversation going on about mental health, everything from ADHD, anxiety, depression, autism, dementia. But you've got to understand the mind, or the mental system, relies on a brain, and the brain relies on a gut to feed it. And this has been the big missing equation, and why mental health has escalated to this sort of epidemic proportion, or mental disease, is because not enough emphasis has been done to actually focus on brain health. Now, this has been a big part of my work now for a number of years. We initially started to target the adrenal system and the effect of the adrenal glands operating with the hypothalamus and the pituitary, and the effect that has on things like dopamine and serotonin and oxytocin, endorphins, GABA, all the issues that actually relate to mental health and mental happiness. But we've now got to look at this whole issue around protein metabolism, protein synthesis, fatty acids, and a lot of the minerals and B vitamins and whatnot. And the great thing with the epigenetics analysis and the well-being solutions that we do, we test for all of this. We test for 800 issues, all the proteins, all the B vitamins, 7 of the main essential fatty acids, all the antioxidants, minerals and whatnot. And in one test we can actually analyze your exact status. It's like a snapshot of your nutritional status, including the microbiome, which is a form of a brain, and like a hive brain, like a beehive type brain, full of bacteria. And the relationship through the vagus nerve and through a superhighway from the gut directly into the brain. So there's a nutritional highway, a chemical highway from the gut to the brain, but there's also a quantum highway, or a superhighway that people like Deepak Chopra has done a lot of research in. But from a perspective of this seminar that I did, it really helped to isolate. And this is a professor based in New Jersey, in American universities, who has a background in psychology and nutrition and criminology and sports performance. So he's a very whole systems thinker, in the same process that we use whole systems to help people with health. And it just re-emphasised the quality of the work that we're doing, the quality of our analysis around things like protein synthesis or protein metabolism, to build a nervous system that can carry your mental health forward and help you have the sort of resilience and the stamina and consistent high performance that's required to live in a modern world. And if you're not consistent, if your nervous system's not functioning consistently because you don't have enough minerals or B vitamins or amino acids, or you're not synthesizing and metabolizing those, then of course your health will be very sporadic. Your nervous system will be up and down like a yo-yo. And the issues around fatigue and anxiety and ADHD, this lack of an ability to concentrate because your nervous system's not functioning effectively, you're getting like a cell phone dropping its reception on a regular basis as when you go around a corner, and that's what's happening to a lot of people's brains. They're dropping reception, the receptors aren't connecting with each other, you can't concentrate for long periods of time, your attention starts to go into a deficit, and it's simply a brain related issue. It's not just a mental health issue, it's a brain health issue. But that brain, as mentioned right back in the beginning, sinks back to the gut. And there's a correlation also with your hormones, your adrenal system, your thyroid, and a whole range of other hormones like your hypothalamus and your pituitary. So without a whole systems approach to this, it's impossible to have consistently good mental health. Drugs are not going to help cure this. They'll help alleviate some of the problems, and they of course have a benefit for a lot of people. But for you to have a consistent high quality mental health, you need good quality gut health, good quality brain health, and then you run the programs through your mind using those operating systems. In other words, if you've got a broken iPhone, doesn't matter how good your software is, the hardware's malfunctioning, so your brain is your hardware. So to have ideal mental health, to be able to concentrate long terms, to not have depression, to not have anxiety, You need a healthy brain and a healthy gut. Look forward to helping. We test for all of this with one test. We've got a lot of programs, whole person, whole system programs. Been doing this a long time now, 10,000 people we worked with. Know exactly how to help you. This can either be at a corporate level, a B2B, or just with private individuals. So it doesn't matter at which level we're working. But executives, and I've got some more information come through in the last few days about the number of CEOs just dropping dead at work. The stress of being an executive and making decisions, difficult decisions every day is significant. You have to have good brain and nerve health. Look forward to helping you, and I'm sure we can.